So it's really my pleasure to introduce our first scoping talk, talking about community health. There's really nobody who's better suited to give this overview than our very own Susan Anenberg. Susan is a professor at George Washington University, where she leads a group that has become truly the preeminent health impact of air quality voice in the United States. It was great to see her on the news talking about risks from the LA wildfires. And, you know, she's really proactive in stepping out to give public comment and public engagement on a wide range of socially relevant issues. And so we're excited to hear her perspectives on satellite data for community health.
Thank you, Tracy. Hi, everyone. I am just absolutely delighted and honored to be here speaking with you today about how we use satellite data for community health. My interaction with HAQAST goes all the way back to HAQAST when I was an air quality manager when I was working at the Environmental Protection Agency, and had a chance to be part of the last HAQAST as a co-investigator and now the current HAQAST as a PI. And I have to say, as some of the speakers earlier were talking about how HAQAST has really played a role in transforming people's careers. It has certainly changed the direction of mine for the good. And you know, I want to give a special shout out to the George Washington University Master of Public Health students who are in the audience, because we're continuing this pathway of teaching students the importance of satellite data and how it can be used now for community health. So I'm going to move forward here. Now, why are we talking about community health when we're using devices that are hurtling through space? We now can use satellite data to estimate exposure for people at the neighborhood scale. Where am I supposed to point this at? There we go. Okay. So yes, satellites are in space, but what they're observing can be used to estimate exposure for people as they go about their lives within cities, within rural areas, and we can use that exposure information to learn about how pollution and other environmental health risk factors is affecting their health. So these are a couple examples of how HAQAST members have used satellite data to estimate exposure within urban areas to air pollution. This is PM 2.5 concentrations, fine particulate matter that can penetrate really deeply into our lungs, get into our bloodstream, and affect every organ of the body, from Yang Liu's group at Emory. And from my group at George Washington University, nitrogen dioxide concentrations in the Washington, D.C. area. And now these are not straight satellite data. We combine the satellite data with information from other sources to get at a more granular level within urban areas. But now we have been able to produce statistical models where the satellite data is really the primary driving factor of the estimated surface level ground concentrations where people breathe. So we can't do as good of a job estimating exposure and how it differs within urban areas without that satellite data. One special part about HAQAST is that we're not just, you know, a PI working over there with their team and a separate PI working over there with their team. We really work together, and that's really something that's special that you don't find in other grant programs. And so I'm going to share some of the key accomplishments from HAQAST as a whole, and then I'll also talk about some of the research projects that individual HAQAST teams did to use satellite data for community health applications. So, you know, I mentioned on the last slide how important satellite data can be in estimating surface concentrations and capturing the differences in concentrations experienced at the neighborhood scale within urban areas. But there's still a bit of a disconnect between those satellite data and the ground level concentration estimates that scientists are producing. And there's a disconnect between that and the users who may not be familiar with the satellite data or may not be able to access them quite as much. And so one of the things that we did as a team throughout HAQAST is to integrate satellite data into mapping tools and to get them into the hands of people who are not typically using satellite data, downloading satellite data and analyzing it. And so at the picture on the top here is a widely used EPA mapping tool, and on the bottom is the Climate Vulnerability Index that was created by Texas A&M University and Environmental Defense Fund. And so by integrating satellite data into these tools, which are publicly available and anyone can access them, people can access the information about what levels of pollution there are in their neighborhoods and how do their neighborhoods compare to other neighborhoods within the urban area. Those simple questions that are really important for people to understand how to protect their own health or potentially stakeholders that are tasked with protecting local public health, they need to know this information so that they can act accordingly. Another way that we have improved access for people who may not be the satellite super users that we talked about earlier is by reformatting the data into formats that people are more familiar with. And so on the left-hand side here is an example that was done by Gage Kerr from George Washington University. You know, the satellite data and the models that we use to predict surface concentrations from them are typically on a gridded level. So we divide the United States into pixels and we estimate concentrations in every one of those rectangular pixels. But many of our stakeholders and many people that need to use this information for community health are working with more administrative boundaries. So, you know, maybe it's a state or a county or a census tract or even a block group. And so we were able to reformat the data, essentially aggregate the pixels into these administrative boundaries, and then that connects with the other data that the stakeholders need to provide the analyses that they could use to protect public health. So that's one way that we improved accessibility. Another way is an example from Tracy Holloway's group at University of Wisconsin, where you see that there are downloadable files in NetCDF format, and maybe some of us in the room are familiar with NetCDF and how useful that is to code with. But maybe you're not, and you're familiar with shapefiles, and you like to work in a GIS format that has a graphical user interface. And so just reformatting the files to shapefiles and making them more easily downloadable, this is an incredible service to stakeholders who never before had been able to access the satellite data and work with them. Now they can just download the shapefiles and put them into their GIS format, and again, work with the other types of data that they have within that GIS frame as well. So I mentioned that we work together as a team, and that's a special part about HAQAST. But many PIs, many of the HAQAST PIs and the teams that they worked with were also able to use satellite data to address community health through their individual projects. And some of them are not individual, some of them are collaborative across HAQAST PIs, and that's truly wonderful. And so this is one example from Chan Chow from University of Texas Health Sciences Center, and she was studying light at night. Now, this is an image of what we might find from satellite data where it looks like there's these blobs of light at night over urban areas or built-up areas. And, you know, you may not know how much variability there is in that environmental health hazard within an individual urban area. So now being able to map this at a more granular level, we can see that there's quite a bit of variation within an urban area. And each of our health, when we're talking about community health, we're a product not of the citywide average environmental health risk factor, whatever exposure that is. We are a product of what's happening in our local environment, right? Like what each of us individually are exposed to and what are the people around us exposed to. So being able to map things in a more granular scale like this can help improve analyses of the health risks associated with light at night and also what we can do about it to address those health risks. Tracy Holloway's group did a really important integration of satellite data into a widely used atmospheric model called I always refer to it as INMAP, but it's the Intervention Model for Air Pollution, or INMAP model. The reason this is important is because if you're looking at intervention, some kind of way to reduce pollution to improve community health, we have to be able to run a model to explore hypothetical scenarios. Those are not observable, right, because the action has not been put in place yet. So by running a chemical transport model or an atmospheric model and integrating satellite data within it, we get a better estimate of how different actions might improve health for communities. Oh, here we go. All right. Arlene Fiore's group from MIT works with folks from Columbia University, Susanna Adamo and John Squires to develop learning and training modules. And again, this goes back to the importance of training students to be able to understand how satellite data can be useful for community health. You know, I have to say from a personal standpoint, being, I'm the chair of the Environmental Health Department at George Washington University. When I joined the department as a professor, no one was using satellite data. It wasn't a thing. You know, people are using monitors, people are going out and taking samples of things, and that's so important. Of course, we need to continue that. But satellite data are transforming our capabilities to assess community health, to research it, and to address it to improve health for people. So developing these training and learning modules are so important for students to be able to learn how satellite data can be used, what's the value of satellite data, what are the strengths, and what are the limitations. And so they focused here on heat, air pollution, and health, and also tree canopy cover and outdoor workers exposure. And this was a class for undergraduate students. And so here we have undergraduate students starting to interact with satellite data and map it for community health applications. Yang Lu's group from Emory, as well as our group from George Washington University, studied how trucking around warehouses has contributed to air pollution within the neighboring communities around those warehouses. So you have an example from Emory University in the middle here showing PM 2.5 concentrations in a very heavily warehoused area in Southern California. And then on the right-hand side is an image from Gage Kerr from George Washington University, which is an aggregate, it's a composite of air pollution impacts, nitrogen dioxide impacts around warehouses across the country. And so that white dot represents all warehouses across the country, and if we rotate the satellite observed nitrogen dioxide concentration so that the downwind direction is always to the right, we see that there's somewhat of an offset peak impact on nitrogen dioxide to the downwind communities around those warehouses. The last example I'll give is one that we led at George Washington University to integrate nitrogen dioxide pollution into the global burden of disease study so that there was a new risk outcome pair, NO2 concentrations and pediatric asthma incidence in the global burden of disease 2021 study. While nitrogen dioxide is not the biggest killer when it comes to air pollution, that would be PM 2.5, and PM 2.5 consistently ranks as a top 5 risk factor when it comes to global mortality. When you look at individual cities within the United States, and here I've pulled out the ranking of risk factors in the District of Columbia for children aged 5 to 14 years for disability-adjusted life years. That's loss of healthy life years. Nitrogen dioxide pollution is number 5. So this is not, air pollution is not a problem that we have solved in the United States. It's one that continues to impact public health. And so this is my last slide. I'll just remind you of the key accomplishments that we made across HAQAST for community health, integrated satellite data into mapping tools. We increased accessibility of satellite data, and we fostered research as well. None of this could be done without the many people who are involved as HAQAST PIs, co-Is, postdoc students, et cetera. And of course, none of it could be done without NASA. So thank you very much. Appreciate it.
Great job, Susan. Thank you, Susan. That was great. Our next scoping talk will cover another big headline issue, not just for HAQAST, but in the news every day, which is the impact of wildfires. And, you know, we are interested both in wildfires and in agricultural fires. These are, you know, both prescribed and uncontrolled. And the consequences of these fires are so broad, from the direct damage to the smoke, to the regulatory implications of the smoke, the health effects of the smoke, understanding the health effects, connecting with the health research community. And satellite data is just a huge part of that narrative, because the eyes up in space can look down and see these patterns and fill in the gaps where there's no monitors. And to tell us about that is Jeff Pierce from Colorado State University, who has been working with a team both on the health side and on the atmospheric science smoke diagnostic side to really give us a 360 overview of this topic, and excited to hear your talk. Thank you, Jeff.
Thank you, Tracy. And to echo what Susan said, I'm really grateful for NASA for allowing me to serve on this team and for being able to work on problems that I couldn't have imagined 5 years ago through meeting new people and thinking of new places where we can help. So it's just been very fulfilling, so thank you. All right, so I'm going to talk about just a taste of some of the many things the HAQAST team is doing to better understand and quantify wildfires and smoke and their impacts. What I'm going to show here won't be everything because there's just so much to work on with this, but hopefully this gives you a taste of the types of things we're doing on the team. So all of us now, no matter where you live in the US, understand that large wildfires and smoke from those fires are a continental problem now. It doesn't matter if you live 1,000 miles from the fire, you may be being exposed to that smoke and you can feel the effects of that smoke. But I also want to point out one of the things I'll talk about it's also very important, but maybe slightly less thought about, is that small fires also can have important regional impacts. So this is just a photo of the Great Plains in the US where there can be lots of small fires and there can be quite a bit of smoke from these fires as well. And so the team's been working to understand the fires and from these smaller fires as well too. So as an overview for the talk, we're going to step through 4 questions that sort of cover the basis for what HAQAST has been working on. So we're using Earth observations to answer the following questions. So when we have a fire, how much burned? How much smoke were people breathing after a fire occurred? Can we go back and really try to quantify in your city, what were the smoke concentrations on a given day? Or if you're away from the city, away from the monitor. What are the health effects of smoke, as well as where is smoke going? How well can we evaluate and improve smoke forecasts such that people can protect themselves for smoke coming the next day or in 2 days? So just starting with how much burned. So this is work I'm going to highlight now from Amber Soya and Emily Gargolinsky that they've been working on. So small prescribed and agricultural fires are essential, but our understanding, particularly of the smoke impacts and how much have burned, is limited. So prescribed fire has this potential to decrease extreme wildfires. It's good to help with the ecosystems, as well as it can help agricultural productivity. So there's many good reasons to have prescribed fires. And while prescribed fire can be helpful, the smoke from it is never helpful. And one thing that's an amazing statistic is in some fire years, when we have less wildfire in a year, the total area burned from small prescribed fires, when you add it all up, can exceed or be equivalent to that of the large wildfires in that year. So even though the large wildfires are what gets the attention, just as much area can burn from these smaller fires. However, the small fires, particularly like how much burns, is not well defined. And any given year, there's a lot of uncertainty in how much burned and where in our inventories and accounting of these fires due to limitations of traditional satellite instruments that have been used to understand fires, as well as differing reporting requirements depending on the state. So what Amber and Emily have been working on is using new high-resolution data from satellites such as Sentinel-2 to really get at exactly how much burned in a small wildfire. And this is just showing an example where the black shows stuff that is already done burning, and then the yellow shows fire that's currently burning. So this is an example from one of our study areas that HAQAST has worked on in the Flint Hills of Kansas that shows on the right, there's a field that burned in the previous day or two, and on the left, you can see a currently active small fire. And so through their work using these high-resolution satellites, when you use those satellites, what they were able to find out is that from our traditional active fire detections that are typically used to understand fire, only 30 to 47% of the active fires by number are detected, and you can capture much more with these high-resolution satellites. And in terms of the total burned area, our traditional way of accounting for them only gets 14 to 65%, depending on the ecosystem. So what this really highlights is that there's this potential for high-resolution satellites such as Sentinel to allow for a more complete characterization of small fires. And where this is going to be really helpful is in building emission inventories of smoke within health studies, as well as ecosystem studies for when you have a fire, how did the ecosystem change? And so for more on this, Amber and Sherry are going to be speaking in session 4 on this. Okay, so how much smoke were people breathing when we have had wildfire, prescribed fire, smoke events. So the United States has the most extensive particulate matter regulatory monitoring network in the world. And if you look at it, it's kind of amazing how many regulatory monitors we have. But if you really dig down and think about smoke and what smoke looks like, you have these narrow plumes that have really steep gradients in the concentrations. And this fire is happening in northeastern New Mexico in here. And it's going into an area where there's only one monitor at Amarillo, Texas. And there's all of this gradient in it, and there's actually a dust plume coming in from Colorado at the same time. And our monitoring network is not going to be able to say for the people, the farmers who live in this area, are what they're breathing different from people who live 10, 20 kilometers away. And so this is where the potential for satellites really comes in to understand wildfire smoke for what we're breathing. So the question NASA's and HAQAST has been working on is, where can satellites help and other data sources? So we try to get at it through combining data sources and taking the good information from each of the data sources. So what we have at our disposal, we have effectively weather models with smoke in it. It's blowing smoke around, and we try to estimate what the emissions are. And these tell you everything you want to know, but it's not necessarily right. And so it's prone to errors in smoke emissions and transport. We have our satellite data, which is great at detecting the plume's spatial extent, but it doesn't directly tell you precisely what the concentrations are at the surface. And we have our regulatory monitors that tell you the right answer, but they're not everywhere. And so what can we do by taking these three data sources, blending them together, and coming up with continuous estimates of smoke concentration? And so this is just an example by work. This is Jen McGinnis, who's in the room, who Tracy showed work by her earlier as well. And this is just showing that with these sort of combined data sources, we can look, this is the annual US average fine particulate matter concentration since 2006. And if you average across the US, the solid blue line, it includes smoke, shows that our improvements due to cleaner cars, cleaner industry, has somewhat leveled off in recent years. But if you account for how much of that is smoke from these blended estimates, and you remove the smoke signal, you can see that, yes, we are still improving our particulate matter air quality from anthropogenic sources. It's just that the bad wildfire seasons we've had in recent years has been distorting that improvement and causing it to be impossible to detect it from our monitors alone. And using these products of blended stuff is a large number of state health departments and ecology departments, as well as hospitals, foundations, Department of Veterans Affairs. So as an example where we can use different data sources, it comes from our Tiger team, where we studied prescribed fire burning in Kansas. And so I showed one of the images from Amber's group before on the fires, and Cheryl and Amber led this together. And this is just showing eastern Kansas on days in the springtime where lots of people are burning their rangeland fields. And you can see that the peak in the smoke happens between the blue regulatory monitors up there, and the orange are the purple air monitors. This is just public citizen science cases. So to help understand the smoke in this region, through the Tiger team, we sought more citizen scientists that put up these monitors in there so we could really characterize the smoke. And once we knew where the smoke was and how much it was, we could ask the question of how well do satellite-derived particulate matter products quantify smoke in this region? So if we hadn't had this campaign, we didn't put those monitors out, how well could we have used satellites to understand what the smoke was? And so on the right there is the concentrations measured by the monitors, and you can see there is this, it's not really working. In eastern Kansas, there's this peak in concentration there. And then here's two different satellite products, one from Randall Martin's group, and another from the GHOST satellite, the NOAA team, both showing that maximum in eastern Kansas during this time. So this is without the purple air monitors and whatnot. These satellite-derived products are able to show us that there's this higher concentration of smoke in that region. So what are the health effects of smoke? And so by using some of these blended products where we're taking satellites, models, and surface air quality monitors, various epidemiologists we work with and on the team are able to look at health effects. And I'm just highlighting two, Cheryl and Yang have been on a lot of these studies understanding the health effects and just looking at the connection of smoke with many different outcomes. Just look at the range here from cancer inhaler refills, things like anxiety, mental health, birth outcomes, even there's been studies connecting wildfire smoke to domestic violent crimes in terms of just people being stuck in the home potentially or having respiratory symptoms making them irritable. So just a lot of work has been unlocked through HAQAST in this realm. And many different partners, we've been working with this as well. So they're both giving talks later today. We can learn more about this. So the final question is, where will smoke be? And so just to highlight a couple projects on this, Jun Wang, who I'm not sure is here, has developed a tool taking two different NASA forecasts from GSFP and GOCF and making it easy to use data display to actually look at where smoke is going. So it's easy to find where smoke will be using this tool. I put a QR code up there if you're quick. I'm going to have to change this slide pretty soon if you want to actually use it. Working with many different state agencies to try to best make this usable for them. And then finally, Daniel Tong, who will present later today, was trying to evaluate how good are smoke forecasts and how can we make them better. And so these are plots from 5 different forecast models where the dots show the actual concentration that was measured on a given day. And then the contours behind it show the different predictions. And just look at how varied they are, from very high concentrations to very low concentrations. And what Daniel's group found is that by combining information from all the different model sources, you can come up with an ensemble method where you're coming up with a much better prediction. And so this is moving things forward in a way to be able to make better smoke forecasts. And Daniel will talk in session 3 with this being part of it. And so just to recap, just sort of touched on many of the different areas that HAQAST is working, trying to figure out how much burned, how much smoke people were breathing, what those health effects were, and what can we do to forecast smoke. Thank you.
About 3 minutes for questions? Yes.
Hey, Scott.
Peter, I was wondering, has anybody done any study of species involved in these fires and the relative health effects, specific hardwood versus conifer versus grassland?
I'm aware of some toxicological studies in labs with mice that have been looking at these things as well as burn conditions, whether it's burning and smoldering versus flaming conditions. I'm not aware of anything on this team that's done that. You need special measurements where you're getting the composition and associating with it, although I guess in theory you could just take the ecosystem type of what was burning and look at that as well. But I don't know if, Cheryl's nodding her head. Yang, I don't know if anyone else. But yeah, I mean, that certainly is something that we want to understand.
Hi, I'm Teresa Bullock. I'm a nurse out of Rochester, New York, and I was very interested in the PowerPoint piece where it said that you saw an increase in domestic violence. You were able to identify that with the satellite data. Do you know if any PSAs were done or any education is actually being done in Los Angeles right now to kind of make people aware that this is what has been identified in the past and how we can possibly prevent someone from being harmed?
That's a good question. I haven't been involved with the outreach on that. So Susan, I don't know if you have. I know people at South Coast Air Quality Management District have been in charge of a lot of the messaging on that, and I'd be good to check in with them to I know that there's a lot of concern about that, particularly in that case with Los Angeles. One of the big concerns is that when you have structure fires, you have different material burning than wood and vegetation, and could be potentially very different effects when you're burning plastics and those sorts of things. And so there's been a lot of messaging on that too. I know people are concerned about it. But.
I think that's our time for questions right now, but we'll have another set after this. Thank you.
So the third of our scoping talks, thank you, Jeff, is being presented by Barron Henderson. Barron is a physical scientist at the U.S. Environmental Protection Agency, EPA, in the Office of Research and Development, and ORD. And Barron is really a perfect person to be giving the stakeholder perspective on HAQAST over the years. I first met Barron back when he was an assistant professor at the University of Florida and was working with satellite data for health applications. But he's really spent most of his career at EPA, and through not just this generation of HAQAST, but the previous generation of HAQAST, really Barron has been involved in so many projects. People say, well, I'm working with Barron. Well, I'm working with Barron. Oh, I'm working with Barron. Oh, I just saw Barron at a meeting last week. So Barron is really baked into the DNA of HAQAST, and he's also leading validation efforts for the new Tempo instrument. So, you know, Barron has a big picture perspective on the impact of our group, and, you know, especially, of course, on his home organization of EPA. So thank you, Barron, for joining us.
Such a kind introduction that now Barron is blushing. Okay, so I'm really excited to be here to talk to you about this from a stakeholder perspective, from a partner. Dr. Wagner talked about the bridges in delivering products to different stakeholders, and what's really important here is if you deliver a product and nobody uses it, what have you done? So what I want to talk about is the success story about the EPA receiving products and putting those out to the community. So not only did we do the collaborations, but we turned around and they made concrete benefits to the public. So I'm going to start with a message I had to deliver a lot 5 years ago, which was a reminder to people that, in fact, the EPA does use satellite data, and we have for a long time. What that means is we have all sorts of satellite data products coming from a bunch of different satellites that, as Jeff talked about, might be used in developing emission inventories. They're also used in developing meteorological models. They're used in developing composition constraints on our models. But what you'll see up here is inputs to models, maybe input and evaluation. But the direct application is something that is lacking. The other thing you'll see here is that there's a bunch of stars for the inputs, a couple stars for the input or evaluation. But you'll notice there's a lot more satellites out there than there are stars. And for every one of those satellites, there are many products. And the stars don't represent usage of all of the products. So I'm highlighting that there's a lot more to do. So how can we use the millions and billions of dollars of assets that are up there to improve what we can do at the EPA? And the question is not just about NASA. There are satellites from NOAA as well that this represents. They're just not on this slide. And the answer to how can we do that is by working with HAQAST. They help us advance the way we do things. So the way EPA works in this setting and the way that stakeholders work is we partner with HAQAST. We partner not just on the Tiger teams that maybe we've been talking about so far, but also in core projects. So we act as panels, we act as stakeholders on the individual core projects. And then over the last 2 rounds of HAQAST, we have participated, or at least we're named as participating in 12 Tiger teams. There are some that we participated in where maybe we weren't on the named list there. So we also participate in the rapid response teams. Those are the ones where something topical happens, fires happen, and immediately there's a rush to try to make sure that we're doing the best we can on that topical issue. Now, I've got 10 minutes. I'm not going to discuss all 12. I'm barely going to discuss the ones that I am, but I'm trying to drive home the message that when we partner, there are tangible outcomes from that that benefit not just the EPA, but the public. The 3 that I'm going to talk about are a project assimilating satellite nitrogen dioxide into our models, and that was used in our 2019 multi-pollutant platform. That one's a little bit less tangible than the other 2 I'm going to talk about, but it's important because it shows the staying power of the partnerships where the technology transfer continues to pay dividends. The other 2 I'm going to talk about are moving data products into an online mapping tool that brings nitrogen dioxide for the first time into that tool. And then also I'll talk about AirNow, which is probably one of our most public interactive experiences that people use for air quality, bringing in near real-time satellite data, specifically here particulate matter. So for the assimilation project, Brad Pierce and Daniel Tong worked very closely with us to transfer technology that would help us do better data assimilation than we had done in the past. What is assimilation? It's a fancy word for saying pushing a model from wherever it was going to go towards a set of observations. When we do that, there are a couple things that immediately come out of that that are useful to us. We can actually ask the model, what would the emissions have needed to be to realize that outcome? So this matters because when we do a model of the atmosphere, we have to include emission inventories, not just from the US, but also from other countries that transport pollutants into the United States. So we work really hard to develop our own emission inventories, but it would be impossible for us to develop a perfect emission inventory for China or India or the entire East Asia or Europe. So what we have to do is we use assimilation to adjust emission inventories for those places. And when we do that, we get updates and we can use those, and those inform our models, which inform our products, which inform the public. The next one I'm going to talk about is how HAQAST has benefited the EPA mapping tools. So EPA has pollutant screening and mapping tools that are publicly available, and Susan showed a similar graph here. But what I wanted to highlight was when we worked on this Tiger team, there's a couple things that people have talked about so far. Tracy talked about people needing to get comfortable with data. When there's a new data product, we don't just immediately assume that it's perfect. EPA has questions. Susan worked very closely with us, and Gage Kerr worked very closely with us to answer our questions about it, to extend the evaluation of it, to compare it to EPA's own data products. And in doing so, we built a comfort level that made us ready to include it in our mapping tools. In doing so, we realized two firsts for the agency, a first for a satellite data product in that mapping tool, and a first nitrogen dioxide product in that mapping tool. And for the fiscal year 2023, it received a gold medal award at the agency. So there's a lot of good to point to there. The other project is the Air Now project that I wanted to talk about. When people go to Air Now, they see a map. They see a map of the air pollution that is informed just by the air quality monitors that Jeff talked about. And he pointed out that those plumes might be going right between two monitors. So if you interpolate between two monitors that both have good air quality, because, for example, you might have to shut down a monitor in a fire because the electricity is not available, you're going to show good air quality in a place where it's not good. The satellite, on the other hand, would continue to see that space and continue to provide observational data on what's happening. So we worked with Pawan Gupta, Ying Liu, and also with Shobha Kundragunta at NOAA to bring in NOAA's geostationary observations of aerosol optical depth to create a surface PM product. We then pair it with NOAA's meteorological forecast through a complicated machine learning that was published earlier this week. And then that goes into creating a product over here. This is geostationary PM 2.5 to the best of our ability, available in near real time. And we can deliver that right now through the Air Now Tech website so that states can look at it to better inform the public. And that's been live on our Air Now Tech system, which is part of the Air Now suite, since March of last year. That's a huge win. When I look at this, we say, okay, we bring it in, we make it available to the public, and that is a great example of catalyzing interagency collaboration. It wasn't just NASA, it wasn't just NOAA, it wasn't just EPA. We were all working together to make something publicly available. Now, you might notice, of course, that the satellite can't see through clouds and things, so there are gaps there, and how do we work on that? Well, we get pushed as an agency when we have a new product and we see issues like that, and we say we need to do better. So what we decided to do was come up with a way to fuse all sorts of different types of information, the monitors, the purple air, the geostationary satellite data. And we at the EPA came up with a new mechanism for creating continuous best estimates without gaps from each one of them, and then fusing it together to create one absolute best measurement. Now, that's a work that's still in progress that will continue to pay dividends as we go on, but that data product has been public in the AirNow system on AirNow Tech since March of last year. The version that's public is not currently bringing in the geostationary satellite, but that's next. So that's a huge benefit that's available right now. It helps us pick up these types of fire events that are coming through areas with sparse monitoring, and that's HAQAST benefiting the EPA and the public. So to summarize, I've had a great experience with HAQAST. Satellite is currently underutilized because there's so much of it and there's so many products and there's new ones all the time. And so we need to be proactive about using that data, and one way to do that is by collaborating with HAQAST. I hope you got the message that HAQAST has helped us to bring robust data into our pollutant mapping systems, into AirNow, into the public communication. Now, this has been way too short a time for me to communicate all the successes. So I'm just going to reiterate, there were 12 Tiger teams, and each one of them provided different successes that I'd love to talk to you about in the breaks. So I focused on the tangible. I showed you product, but I said things continue to pay off. They continue to pay off because of the technology transfer, and they continue to pay off because the relationships we build continue to pay off even when we're not on a particular Tiger team. So I want to end by thanking Tracy, by thanking John, and thanking all the people that have made this possible. Thank you.
One question? Yeah.
Did I notice that environmental indicator is now called environmental burden indicator? It was hard to see that.
I can't see it either for sure. I didn't.
Okay.
Sorry.
That's
I probably can't answer that.
It's an interesting, I like the title.
Oh, good.
Environmental burden indicator.
Yes, hi, thank you. My name is Milagros Elia. I'm with the Alliance of Nurses for Healthy Environments. My question is regarding whether or not the EPA's cumulative impact framework incorporates parts or some of the work that HAQAST is doing.
Maybe that's better answered by Sherry.
Yeah, some of it is incorporated. The cumulative impacts, that they incorporate all kinds of exposure metrics, and so this would be one of the exposure metrics that goes into it. Yeah. If you want, we can chat at the break. Yeah.
Great. Thank you. Thank you. Thank you. Awesome. Thank you, Barron.